So I realise that this is a controversial topic for some people. For some people, it will be simple and not controversial at all. But I'm going to try and tackle it briefly for you. I've only got sort of 10, 13 minutes or something like that. So let's get stuck into it. And I thought I'd start with three words, which I think are important in terms of how we I guess, view this discussion. And when I was thinking about this, these three words came to mind. Respect. I think we need to be respectful of each other. Freedom. I think it is important that we have freedom of choice and that we respect others' freedom of choice. And protect. And I think it's important that the community is protected. And I think these three things need to try and coexist together. And sometimes that creates tension in how we apply each of these principles. But these are some guiding thoughts I thought I'd start with. And when we, firstly, coming to the Bible, I think is a really good place to start, because the Bible obviously says nothing specifically about vaccination. It can't do, because it was in existence prior to that. But many things in life, we don't have a specific edict from the scriptures, but we have principles to guide us. And so I thought I'd put a couple of principles together, and there, of course, are others too. In Isaiah, we have some clear direction that God is pleased with us when we protect the oppressed and vulnerable, and we restore people to essentially their full purpose. And he is not pleased with us when we have religious sacrifice for the sake of doing it rather than actually doing the weightier matters of the law. That's a fairly clear principle. There's also some fairly clear principles in Romans and Peter that we are to obey our civil governments, and we're to honour and respect people, including those in authority. And that is interesting, given that he wrote that during a fairly oppressive Roman rule. But there's some pretty clear principles about that. We also know that obviously Jesus was incredibly good at standing up for vulnerable people. He really was there for those people, and he was there to essentially support them and pull them out of their problems. And he famously gave us the golden rule, do to others as you would want them to do to you. And these are some principles which I think should overall guide us in terms of how we think about these matters. There's some secular principles which I want to briefly say, and I apologise. Well, actually, I don't really apologise, but I think this is the assumptions, if you want to call it assumptions, but I think they're very credible ones that I'm coming from. And that is that COVID is real. I don't buy into conspiracies that it doesn't exist. The best way, I believe, at this stage to evaluate vaccination is through as much official data as you can get, although it's imperfect. It's probably the most accurate way we're going to be able to judge. So I'm not necessarily going to entertain some sensational blog person who thinks the data is different from what the official data is. And that's just because I think you're on shaky ground when you do that. I don't believe there is a global conspiracy with, governments or Bill Gates or anything like that. I mean, there's just really no evidence for that. The World Health Organization, etc. But I also think it is important to realise that sin corrupts all aspects of society, and that includes science, it includes government, and it also includes anti-vaccination movements. So there's not a pure moral high ground on either side. So the first question I want to address with you is, does vaccination against COVID work? And I think we're getting some very clear data that the answer is it does. And these are the two main papers that I'm going to present to you. You can look them up. They're freely available online. This paper here from the New England Journal of Medicine. And of course, we're talking about the highest quality medical journals in the world here. So we're talking fairly credible sources. We're not talking about nonsense. This is the Pfizer BioNTech vaccine, which is actually, I think, yes, that's the Pfizer BioNTech. This study was published. It shows you how it works. Essentially, it's very clever. They coat a bit of messenger RNA in a lipophilic molecule. You can't really see it here. It gets injected into your body. It'll end up being taken up by the macrophage cells, which are one of the first immune scavenging cells. And the mRNA is basically a messenger to tell your body to produce proteins. And it works essentially by coming into the cytoplasm of the cell. It doesn't go into the cell nucleus. It cannot affect your DNA. And it just, if you want to use the term hijack, that's probably being a bit harsh, but it just sends a message into the place where you produce proteins in your cell, and it produces the spike protein of the coronavirus. And then that gets expressed, as you can probably see here, on the outside surface of the cell. And the immune system goes, what's that? That looks a bit new. And it recognizes that that's a foreign protein and starts to produce an antibody against it. And that's how you develop antibody-mediated immunity to the coronavirus. The messenger RNA then is destroyed by enzymes in the cell, and that's the case of all messenger RNA. It's destroyed all the time. Otherwise, you get too many messages to produce too many proteins at the wrong time, and it's highly regulated in how that's done. The other vaccine here is the AstraZeneca Oxford vaccine, and that was published in the Lancet journal, and this is this paper here. And it also showed that it was efficacious. And I should say, I think this was the first trial which showed it was about 95% effective. You can see here a rough kind of graph here. That's the people who received the placebo in terms of their rates of infection, and this is the people who had the vaccine. So pretty stark contrast that obviously is working. And then the same is true with the AstraZeneca. I don't have the data for you on this one, but it wasn't quite as effective in the first trials. But we've actually seen some later data on this, and I'm going to move to talk about this now. So that's in those previous slides was on the phase 3 trials, which is where you're doing it more in a experimental kind of controlled fashion. This is what happens when you give these vaccines in the real world. And there's a great summary that AstraZeneca have put out about their vaccine. It's actually more effective than is seen in their trials. It's about 89% effective against symptomatic COVID at reducing you getting COVID or getting nasty symptoms. And it really has dramatically reduced the death rates and serious illness rates of infection. Even one shot is 73% effective. So for those of you who might have only had one shot, that's what you're dealing with. And then there was some further data on the messenger RNA vaccines, which is the Pfizer and Moderna vaccines. This is again from the New England Journal of Medicine. And it basically showed in the real world, they were also still very effective at reducing severe illness. There were still a select few people who did get COVID, even who were vaccinated, but they tended to have very mild symptoms compared to those who weren't vaccinated. It also showed that those who did get COVID when they'd been vaccinated had a substantially reduced viral load in their body, which probably means they're likely to be less infectious. And so can vaccination really reduce deaths and serious illness? Well, I think this is probably one of the most powerful charts that I've seen, which is based on some data from the United Kingdom. And you can see here that in the second wave of the outbreak, where they really had very minimal vaccination rates, as the case numbers elevated, the deaths elevated substantially too. In the third wave, where they've now got over 60% of their population vaccinated, and in the elderly groups, that's about 90%, you can see they've had another third wave and the case numbers have risen substantially, but the death rates are basically not moved. And I think that's yes, there may be other factors involved, but I think it's most likely to be showing you how powerful vaccination is at preventing people dying. And this is from the UK government source website. So what about yourself? When you weigh up the balance of risk-benefit, what should you do? And the first thing I want to say is that I'm not here to tell you what to do. This is a decision for you to make on the best available evidence to you. And I'm not going, even though, yes, I'm definitely pro-vaccination, I'm not pro-force. And I want everybody to be able to make their own decision. And our church has a very similar stance on that matter, thankfully. Our church is pro-vaccination, but it is also pro-choice. And there's no, it believes each individual member has a conscience to be able to make their own decision. And I think when you make your decision, if you haven't already, it should depend on a few factors. How old you are. The older you are, the more likely you are to suffer harm from this virus. Death rates are much higher in over 80s, of which there's probably no one on this call that's over 80, but even over 70, it's definitely higher, but it really is dramatically reduced as you get younger and younger. What sort of medical comorbidities you have, so whether you've got diabetes, cardiovascular disease, whether you're obese, things like that do play a role in your risk of COVID. And the other consideration is what level of COVID is in the community. So, it probably makes sense when you're in the UK and there's 30,000 cases a day that there's going to be a high rate of harm come out of that. So vaccination would likely be very beneficial. We've just seen that data. When you've got very little COVID in the community, like we had earlier in the year, because there is a risk of vaccination, we'll talk about this in a sec, it may be, you may be in a situation where you decide against vaccination at that point. But I think as COVID rates rise, there is more of a case to be made. How well you can access medical care obviously is important too, because if you're in the islands and you can't really get to any hospital very easily, then it would probably make sense that you take more interest in vaccination. And then the risk of harm from vaccination. And there is a risk of harm from vaccination. We need to acknowledge this, and I'm going to address that now. So let's talk a little bit firstly about AstraZeneca, because I believe that vaccine is I think it's the only one available to the island people and to Papua New Guinea, etc. But in Australia, and I'm not sure about New Zealand, but in Australia, we obviously have the capacity to have Pfizer for those who are eligible for it, and AstraZeneca. So I'm going to talk about both. But the first thing is the AstraZeneca. And the most common reactions, and this is from the website below there, is the TGA website. So it's where they closely monitor the safety of these vaccines in Australia. Most common reactions for AstraZeneca was headache, fever, muscle pain, fatigue, and nausea. And that is very common. I've seen many of my patients who've had that vaccine felt pretty average afterwards, but it tended to be short-lived for about 24, 48 hours. The most significant, I think, side effect from this vaccine, which we have led over time to understand this better, is what's called thrombosis and thrombocytopenia syndrome. And this is commonly known as blood clotting syndrome. And what tends to happen is the body, for some reason, which we don't totally understand, in rare situations forms antibodies to platelets, which seems to be driven by the vaccine. And the platelets are part of your blood clotting system. So you can actually form blood clots or you could actually bleed. And the most common time period that this happens is between day 4 and day 30 after vaccination. In Australia, and this is from the official data, we have had 90 cases that have been linked to the AstraZeneca vaccine in 6.1 million doses. All right, so overall, if you do the maths on this, it's approximately a 1 in 68,000 risk of that happening overall. But we're also seeing that this risk is skewed more towards young people. It's probably more likely to be 30 to 40,000 in under 40s and more likely 1 in 80 to 100,000 in over 60s. So that's the sort of risk that you're dealing with. And that has led to 6 deaths, which is a little bit more than 1 in a million chance of dying. So it's not, there is a risk. It's very rare. But I think we need to acknowledge it. There is another risk that's still being investigated, and this is a condition called Guillain-Barré syndrome, which is basically where you'll progressively get some level of paralysis in the body. It can be fatal, but most people do recover. But it's not a nice illness. You may take 1 or 2 years to recover from this. There have been 63 reports of this post having the AstraZeneca vaccine, but they have not been confirmed to be causally related to the vaccine. But even if they were, that confers about a 1 in 100,000 chance of this. So this is the sort of risk you need to be aware of before deciding on being vaccinated. What about the Pfizer BioNTech vaccination? Well, the most common reactions we've got here is headache, muscle pain, fatigue, dizziness, and nausea, very similar to the AstraZeneca vaccine. And there is some understanding that there may well be, and this is still also being investigated, a risk of myocarditis or pericarditis. And this is a condition where the heart muscle or the surrounding of the heart gets inflamed, and it can be a nasty condition to have. There have been 84 suspected cases in Australia of this after 4.9 million doses of the vaccine, giving a risk of around 1 in 58,000. Okay, so again, but this is not being confirmed, it's more suspected, but there probably is, I think we'll find a link here. It's important to know if you got COVID, you've got a much greater risk of actually having myocarditis. But those who do get it, that is from vaccination, if there is that link, it's more common in younger men, and it happens within 14 days of your vaccine. So that's the harms that we need to be aware of. Now, I'm just going to briefly talk a little bit about Ellen White's perspective. She did not have anything to really say about vaccinations. I think that's important, and there is no mandate to come out of this. So this is a decision, again, for people to make their own decisions on. But there's some good information on the White estate on that link if you want to look at it. And it's interesting that initially she was, the most experience she had was around smallpox. And she was quite skeptical of the smallpox vaccine allegedly earlier on, because she felt that it had caused harm to, I think, one of her children. However, later on, when there was an outbreak of smallpox in one of the communities she was living, she was convinced by some of the medical staff around them that the vaccine developments had improved, and she agreed to be vaccinated. So context was very important for her, and she was also able to be persuaded with data. So I think that's an important consideration. Obviously, that was her choice. It's not necessarily what you have to do, but it's something to give you a little bit of precedent on. And so my final question, I guess, is on, for those of you who might be still skeptical, really what I found that it comes down to is, who do you trust? If you are very distrustful of governments and official sources like WHO and the TGA and CDC, etc., then yeah, you're going to have trouble with what they're presenting to you because of your lack of trust. If you tend to have general trust in those situations, in those scenarios, then you're going to be more likely to trust the official data. And obviously, I can't tell you who to trust, but I think on average, it's more likely that the governments around the world that are reporting this credibly are more credible sources than some guy on Facebook or YouTube who's decided that he's anti-vaccine and wants to promote distrust. But that's for you to decide. How do you respectfully have dialogue with your family, friends, and colleagues who hold a different view than you do on COVID vaccination? And how should being a Christian influence your dialogue? What we need to understand is sin affects every aspect of society, and nobody has, there can be problems in all facets. So it is possible that scientific data can be suppressed and not properly presented, and some of the drug companies have been called out by this by investigative journalists. So there's not a pure source on their side. But I think in this situation, because of the publicity around COVID, they have had to declare their cards very early, and the trials have been in the public domain very early on. But on the other side, the anti-vax side is not pure either. There is malicious intent from anti-vaxxers that deliberately seeks to provide misinformation, and this has also been investigated by investigative journalists. And some of the links are in the stuff that I've put in the additional material, where they've literally tried to bribe social media influencers to give incorrect data about mortality rates of the vaccine to make people overly worried and concerned. So there are potential for corruption on both sides. It's a little bit more clear that that's happened on the anti-vax side than it is on the vaccine side. But look, I don't want people to get bogged down in that, because I actually think Satan really enjoys us to have these controversies and to get bogged down in reading lots and lots of controversial blog posts here and there. And he loves to mess with our mind. And I think that we're seeing a lot of our members who are getting very upset about this kind of stuff. I think that some of our members are mixing up the civil stuff with the moral stuff. And what I mean by that is I've heard of people actually even leaving our church over the fact that we are insisting we put masks on and we obey the government on, you know, their public health directives, because that's an affront to religious liberty. And I believe strongly it is not. I think it's important that we don't, you know, this is not a mark of the beast. This is not a, we have to obey God rather than the government, because I don't think this is in conflict with that. And we have to be very careful as Adventists to work out where we make stands and where we don't. And I don't believe this is a place we need to be trying to go anti-establishment against the government when they're trying to protect us with putting masks on, etc. Even if you disagree with masks, even if you want to pull out a study or show that that shows they don't work very well, and they're out there, you can find them. I don't think this is the time to have that kind of thing, because it really can destroy and disrupt our focus. Our focus really should be on protecting people. It should be on showing Jesus to people, and it should be on telling them eventually that there'll be a solution to this, which is Jesus coming again.